There is very little known about the experiences of individuals who go through the menopause transition while experiencing incarceration. This is despite that there is an increasing number of women who are of menopausal age experiencing incarceration in the United States. Women ages 45 and older made up 12% of all women experiencing incarceration in state or federal prisons in 1999, and in 2018, women ages 45 and older made up 25% of women experiencing incarceration. The menopause transition is associated with a wide range of physical and psychological symptoms that last, on average, slightly over 10 years. These symptoms can have a significant impact on health and quality of life. We conducted a pilot study with 4 participants recruited from community programs in North Carolina who experienced menopause symptoms while incarcerated in a state prison or county jail. Each participant participated in a semi-structured, in-depth interview lasting approximately 1 hour. Our preliminary findings fall under 5 different themes. First, many participants experienced physical and psychological symptoms that were distressing, disruptive, and in some cases caused significant shame and discomfort. One woman described, "My mental health deteriorated. I had no control. When menopause hit, I had to increase the amount of medication necessary." Women faced barriers to non-pharmacological symptom management, describing inadequate resources for symptom management, including insufficient sanitary pads, clean underwear, or bed linens after episodes of heavy vaginal bleeding, night sweats, or urinary incontinence associated with menopause. Barriers to medical management were also described and ranged from cost of medical care to perceived dismissal by clinicians of symptoms or symptom severity, to a lack of knowledge that medical management could even provide relief for menopause-related symptoms. Women described the lack of social and informational support, describing that they did not know the constellation of symptoms they were experiencing were related to menopause, and described how the symptoms and lack of resources to manage them was isolating. Finally, women described being punished for taking action to manage their menopause symptoms. One woman said, "If you rolled up your sleeves, it was a write-up. If you rolled up your pant leg, it was a write-up." So women who rolled up their sleeves during a hot flash were punished for attempting to manage their symptoms. Even though our data set was limited by a small sample size, it still carries implications for future research and programmatic change. First, it's imperative to understand the extent to which standards of care for menopause symptoms are being implemented in carceral settings. Next, it's clear that there's a need to design and implement menopause-specific programs that offer physical activity, social support, and education. Finally, it's imperative to ensure provision of adequate resources, including hygiene supplies, for the growing population of women who are experiencing the menopause transition while incarcerated in prisons and jails. This work was funded by the Carolina Center for Public Service, and we are extraordinarily grateful to the individuals who shared their stories and experiences for this research.